Hi, you're Bill Snook.
Yeah.
I'm Dr. Jenny Clement. Hi, how are you?
I've been having a pain in my chest.
When did that start?
Guess I first noticed about a year ago.
Okay. Why don't you tell me a little bit more about the pain?
Well, it just keeps coming back, and I'm kind of worried about it.
Where is it in your chest?
It's right in behind here.
Okay. And what's it feel like?
It's like a burning feeling.
And is it there all the time, or does it come and go?
No, it comes and goes. Sometimes I think it's gone for good, but then like a day later, there it's back again.
Okay. When it comes, how long does it last for?
You know, sometimes it can go on for a few hours. You know, I guess it depends.
What are you usually doing when it comes on?
Well, sometimes it comes on after I've had something to eat or a cup of coffee. Sometimes it just comes on, it seems.
Okay. And is there anything that you can do that makes it better?
Tums helps a bit,
Okay.
and a glass of milk quiets it down for a little while.
Have you ever had anything like this happen before?
Before a year ago?
Yeah. No. And if it's been going on for a year, what prompted you to come in today?
I mean, I'd been to a doctor about it before, but my union rep was saying that his father thought he just had heartburn, but then after about like 3 years, the doctor figured out it was angina, and then I started hearing stories about people with stomach aches or chest pain, and they end up having open heart surgery, and I'm just kind of worried.
Are you worried it's your heart?
Yeah.
Okay. I want to ask you some more questions about that pain that you're having, but I just want to backtrack a bit and get some more background information about you, Bill, okay?
Sure.
Have you had any other medical problems that I need to know about?
No, I've always been healthy.
Okay. High blood pressure, diabetes? No? Any problems with your heart ever in the past?
No.
And have you ever had any investigations done for your heart?
No.
No. And what about family history-wise? Does anybody in your family have any problems with their heart?
With their heart? No.
Any other medical problems in your family?
No. Medical? No, not really. No.
What kinds of problems?
Oh, my dad was just my dad and my brother were both heavy drinkers and smokers.
And do you drink?
No, hardly ever. Well, I mean, I'll get a bottle of beer, but I usually don't even finish it.
Okay. And did you used to drink more in the past?
I'd say once or twice, but I mean, watching my dad like that when I was a kid didn't make me too eager to pick it up.
Yeah, okay. What about cigarettes for you?
Yeah, I smoke, but I don't smoke nearly as much as I used to.
Good, good. How much do you smoke now?
Maybe 5 a day.
Okay. And how much did you smoke?
I was smoking about a pack a day
Okay. For about?
since I was 16.
And any recreational drugs I need to know about?
No.
And any medications that you take other than the Tums?
I take Advil sometimes.
All right. How many would you take a day, do you think?
I might take 1 or 2 a month.
1 or 2 a month?
Yeah.
Okay. And any other medications?
No.
Any allergies?
No.
No? And you mentioned that your union rep was talking about, where do you work?
I'm in the Molson bottling plant. I'm a floor manager.
Okay. So you're not working on the line then? You're...
No, I mean, I'll fill in if somebody can't make it, but most of the time I'm just checking.
Okay. And do you have a family, or you?
I got my parents in Pittsburgh, and I got a daughter in Pittsburgh.
And are you in a relationship?
No.
Were you?
Yeah, a long time ago. Yeah, with my daughter's mom. She was my girlfriend, but she didn't like Canada, so she left.
And is your daughter living in the States with your ex-partner then?
Yeah, I never actually met her.
Your daughter?
Yeah.
Huh. What's her name?
Georgina. She named her after my mom.
Yeah, really?
Yeah.
Do you have any contact with your ex-partner?
Yeah, she writes, you know, on holidays and stuff. And I actually got a letter from my daughter. She wants me to come to her graduation.
How do you feel about that?
And I think things are getting out of hand. Just, I mean, I want to go. I mean, I've never met my daughter. I mean, how cool a girl is that to invite dad she's never met to her graduation, and I don't know if I can afford to go.
What's going on with finances? Is that a concern right now?
Yeah.
Yeah.
I'm in a bit of a hole right now.
How come?
I got a bit of a habit, I guess, a problem. I gamble.
How much are you in a hole for?
I'm trying to pay off my visa. They took that away from me. I'm trying to pay off a couple of small loans from the bank that I defaulted on. I just can't seem to catch up. I mean, if my numbers come in, I'll be set. But until then, I'm a little screwed.
What do you play?
Primarily, I play slot machines.
Mm-hmm. I want to talk about that, Bill, but I also want to make sure that I talk about the reason that brought you in here, which is the chest pain that you're having. And there are a couple more questions I want to ask you about that.
Sure.
Have you had any weight loss at all?
I'm not sure. I don't think so. I mean, I haven't been eating all that much.
Okay. Is that because you're not hungry, or you're worried that it's going to make the pain worse, or both?
It's just, I've been going to bed late. I've been waking up early. I usually just grab a cup of coffee before I leave. I'll have something for lunch, but then I'm going straight to the casino after work, and so I'm having usually a hot dog while I'm walking home at night. So.
Are you able to sleep at night?
Yeah, for 4 or 5 hours that I'm home.
Okay. And are you having any change in your bowel habits?
Not that I noticed, no.
Any vomiting at all?
No, sometimes I feel a little sick to my stomach, but I haven't thrown up.
Do you ever get a sense that you've got sort of an acid taste in the back of your throat?
Yeah.
Okay. And any weight loss?
I don't, like I said, I don't know.
Sorry, I think I might have asked you that. Okay. And any dark black stools, black poop like my pants at all? Okay. Do you live in a house or an apartment?
I live in an apartment. It's just a little place. It's about all I can afford right now. Do you think you can do something to help my chest pain?
Yeah, I think so. I think I have a bit of a sense of what might be causing it. It sounds a little bit like you're having some heartburn.
That's what my union rep's dad said he had, but
Yeah.
it turned out to be angina.
Yeah. There's a couple things that make me think that it's not angina, but in a guy your age, I think it's worthwhile to do a baseline tracing of your heart to make sure that I'm not saying it's coming from your food pipe and it's coming from your heart. But the things that make me think that it's less likely to be your heart is how long it lasts for, the fact that it comes on with meals, doesn't sound like it's related to exercise, and do you have any shortness of breath with it?
No.
Or any radiation? Does the pain go anywhere else, or is it just stay right there?
Sometimes it goes up the back of my throat.
Okay. So those kinds of things make it sound more like it's from heartburn, but I hear your concern that other people have been told this and then they found out it was something else. So I think we make sure that we're ruling those things out.
Okay.
But I definitely think that we could start some medication to help with what I think is heartburn, and make sure that you don't have a bacteria in your stomach that could also be causing that pain to be worse. So it would involve a bit of blood work.
Okay.
Okay.
Sure.
There's some other things that you can do lifestyle-wise that we can talk about, like some of your dietary things, like some of the things that you're eating and drinking, I think might be contributing to it. And I think those may go a long way to helping with your symptoms. I think it's worthwhile starting a pill now because it's affecting your life quite a bit, it sounds like.
Starting to, yeah.
The bigger picture, though, that I'm noticing, which is why I was spending a lot of time talking about it, is that you sound like you have a lot of stress right now.
Yeah, I just can't seem to get things under control.
Yeah.
I got to do something about this. I got to fix things up.
Yeah. Who do you have that you can turn to?
I don't really have anybody here. I mean, the guys at work, I used to go to the bar with them, and I'd be playing the slots, and they'd come up to talk to me, and I can't, if I'm in the zone, I can't be bothered, and so most of the guys won't talk to me anymore. So, I mean, my union rep's standing up for me as much as he can, but he can only do so much too.
Are you worried that your job's in jeopardy at all?
I've been coming in late
Yeah.
sometimes, and I'm about the only guy left on the floor that smokes, and so the smoking area is outside of the grounds, and I keep getting caught off property when I'm supposed to be working. So management's been riding me, and my union rep said I'm just turning into a train wreck, so I don't know how secure my job is anymore.
Do you think that you have a gambling addiction?
I know I can't seem to stop. I don't. I mean, it's like a lifestyle choice, isn't it? And isn't it something I can just, I should be able to just turn it off?
Can you?
I don't know. Sure would like to. I mean, I could always, they're offering overtime right now. I could get out of this hole, but every time I think about staying late, I get all twitchy because I want to be heading to the casino.
Yeah.
You have 3 minutes left.
Bill, it sure sounds like the gambling is something that is causing you a lot of problems right now. And it sounds like from what you've said that it's going to be hard for you to stop this without some help. Does that sound fair?
I think so.
And I think that the most important thing is that you acknowledge that. And then the next most important thing is to get some help for it. And the good news is that there's Gamblers Anonymous.
Really?
Yeah. There's meetings and groups that often go through sort of something similar to Alcoholics Anonymous, the 12-step program that can help you stop gambling.
AA certainly helped my dad.
Yeah. And, you know, you come from a family that has a bit of a tendency to struggle with substances, and certainly gambling, it's not alcohol, but, you know, there's different theories about why people run into trouble with getting addicted to things, be it alcohol or gambling or cocaine or, you know, whatever it is. So there's some things that are kind of bigger than you and mean that it's probably worthwhile to seek some help, because it may not be something that you can do all by yourself. And I'm concerned that not only is it affecting your health, you're having, you know, some symptoms with the chest pain that I'd like to sort out, to at least get started on sorting out for you today. But I think I'm also concerned, as are you, that it might affect your job and your ability to go and see your daughter's graduation. And you mentioned that's in the summer or the spring?
It's actually, she's graduating in 4 months.
Okay. So I'm wondering if that might be a short-term goal that we could work towards. You mentioned some overtime.
Yeah.
As a possible way out of this hole.
Yeah.
Would you be willing to come back and meet with me?
Sure.
Okay. Yeah. We could talk about this and get you connected with one of the groups. I do want to examine you today.
Sure.
Because I know you're having the chest pain. I want to have a listen to your heart and your lungs, do your blood pressure, have a feel of your belly. And we talked about the blood work. I think it's worthwhile maybe meeting with our nutritionist as well to go over some of the changes that you could make to your diet to help with that pain.
Sure, yeah.
And I think we'll get you some medication so that you can help at least take the edge off of that.
And your time is up.
Okay.